I'm Terry Hill. I'm Vice President of Medical Group Services at Hill Physicians in Northern California. The title of my talk today was Multi-Level Assessment and Accountable Care.
Terry, thanks for your participation today. How would you describe or summarize your work in relational coordination that led to your presentation at the workshop today?
Actually, I got to relational coordination by meeting Jody Cattell, who was interested in organizational scholarship, which for the most part we in healthcare know very little about. And Jody is one of the organizational scholars who has managed to bridge the academic understanding of how organizations work well or don't work well with healthcare. So her work in healthcare has been groundbreaking, and her tools seemed like an obvious one to use in my situation.
Terry, what are the key takeaways from your relational coordination work that you were presenting today?
The work that we've done with the relational coordination survey in particular was looking at the working relationships across two organizations, my organization, a large IPA, and a hospital organization. And we looked at the work that we do at coordinating the patient's progress into the hospital, through the hospital, and then back out of the hospital. So that is an important piece of the work we're doing in our commercial, private sector accountable care organizations.
The RCRC Roundtable focuses on working together, building knowledge, advancing research, and best practices. What were the lessons learned that you captured in the RCRC dialogues, discussions, and reflections that happened today?
You know, the relational coordination survey looks at coordination of patient care at a given moment in time, and then a lot of the work I presented is about also doing inter-organizational assessments at other levels, both middle management and senior management, and the trust and collaboration that really needs to take place there in order to support the coordination at street level, at the bedside. What we talked about a lot during the day was how to get from A to B, how to move from a good coordination to great, or as is unfortunately often the case, how to move from mediocre at best to competent. And so a lot of the work that I think people talked about today and it needs to happen has to do with innovation. What innovations do we need to put in place to support relational coordination? And then implementation, how to get there. What do we need to know about the political dynamics to make relational coordination interventions work? How do we have adult conversations about the really hard stuff? The relational coordination sort of maps out a goal for us. We all have to work collectively together to try to make it happen.
Finally, what are your next steps as you develop relational coordination within your institutions and for your patients?
We've made a lot of progress in the partnerships that we've got, again, thinking about the physician group, the hospital, the health insurance company. So we've made a lot of progress. I think it's about learning how to do things that have never been done before. How do you organize care reliably for every patient every time when you're talking about different organizations working together? How do you bring those together? What's the infrastructure necessary to make that happen? And how do we get there? It's unexplored territory, and we need collectively to figure it out, and we need to do it quickly.
Terry, thank you for your participation in the Roundtable this year.
Thank you.